Today, I'll be presenting on mental health and counseling considerations for immigrants in the United States. This presentation will explore the characteristics, strengths, and challenges of this population, as well as their perceptions of counseling and barriers to accessing mental health services. I will also discuss culturally responsive counseling strategies, ethical considerations, and local resources that support immigrant communities. Finally, I will reflect on my own cultural lens and biases, as well as insights gained from attending a cultural event. Before discussing counseling considerations, it's important to understand the scope and complexity of immigrant populations in the United States. Currently, there are approximately 46 million immigrants living in the United States, making up about 14% of the total population, and over 1 in 4 US residents are either immigrants or children of immigrants, according to Pew Research Center. However, it is critical to emphasize that immigrants are not a monolithic group. Research by Kunst and colleagues highlights the diversity of immigrant experiences and the ways in which majority group perceptions can shape integration and identity. Migration experiences themselves vary widely. As Vargas and colleagues explain, individuals may migrate voluntarily for opportunity, be forcibly displaced due to violence or instability, or exist within mixed status family systems, all of which shape lived experiences in different ways. Despite this diversity, there are some shared patterns. One of the most widely documented is acculturative stress, which refers to the psychological strain of adapting to a new cultural environment. Larius identify acculturative stress as a significant contributor to anxiety, depression, and overall psychological distress among immigrant populations. Additionally, many immigrants engage in ongoing identity negotiation, balancing aspects of their culture of origin with the dominant culture. This process can influence well being and belonging, as discussed by Kilpajokainen and Kwan. Importantly, structural factors such as immigration policy, discrimination, and access to resources play a major role in shaping outcomes. Malturud and colleagues highlight how stigma and broader social conditions can increase stress and mental health challenges. At the same time, immigrant experiences are not defined solely by risk. Research also points to protective factors, including resilience and strong social networks, which can support positive outcomes despite adversity. Overall, it is important to remember that immigrant populations are highly diverse, shaped by both systemic challenges and significant strengths, an important foundation for understanding culturally responsive counseling. Building on that foundation, it's important to understand that immigration is shaped by complex political, economic, and social forces, and that individuals arrive through very different pathways, including voluntary migration, forced displacement, and mixed status family systems. When examining immigrant populations, it is essential to move beyond deficit based perspectives and instead recognize both the strengths and challenges that shape their experiences. Starting with strengths, one of the most consistently identified protective factors is the presence of strong family and community networks. Many immigrant communities emphasize collectivism, interdependence, and maintaining close family ties, which can serve as critical sources of emotional, cultural, and financial support, according to Durr and colleagues. Related to this is the concept of cultural continuity, particularly through language. Research by Kilpi Jakanen and colleagues shows that maintaining a heritage language within the family is associated with better mental health outcomes, especially when it supports stronger parent-child relationships. This highlights how cultural preservation can function as a protective factor rather than a barrier. Another important strength discussed in the literature is resilience, often referred to as the immigrant paradox. Despite facing significant stressors, some immigrant groups demonstrate equal or even better mental health outcomes compared to US born populations. Marginian and colleagues suggest that this resilience may be linked to strong social support system, cultural values, and adaptive coping strategies. However, alongside these strengths, immigrant populations also face significant challenges. One of the most prominent, as discussed, is a culturative stress, which arises from the pressure to adapt to a new cultural environment while maintaining aspects of one's original identity. As Larius and colleagues explain, acculturative stress is associated with increased risk for depression, anxiety, substance use, and overall psychological distress. In addition to this, many immigrants experience trauma across multiple stages of migration. Vargas and colleagues emphasize that, particularly for those who are forcibly displaced, trauma may occur before migration, during the journey itself, and even after arrival due to ongoing instability and uncertainty. Another major challenge is discrimination and stigma, both at the societal level and within mental health contexts. Malcherud and colleagues found that perceived mental health stigma is strongly associated with increased stress and depressive symptoms among immigrants. Finally, immigrants face significant barriers to accessing mental health care. A systematic review by Durr found that immigrants are less likely to use mental health services despite equal or greater need due to barriers such as cost, lack of insurance, language differences, and unfamiliarity with the healthcare system. Taken together, these findings highlight that immigrant populations are not defined solely by vulnerability, but rather by a complex interplay of resilience, cultural strengths, and systemic challenges. Understanding both sides is essential for providing effective and culturally responsive counseling services. When considering how immigrant populations engage with mental health services, it's important to first understand the attitudes and beliefs that shape their perceptions of counseling. Stigma plays a significant role in how individuals approach mental health care. Malturud and colleagues found that higher levels of perceived mental health stigma are associated with increased stress and depression and can also discourage individuals from seeking professional help. In addition to stigma, many immigrants rely more heavily on informal support systems. Durr notes that individuals often turn first to family members, friends, or religious leaders when facing mental health concerns, rather than engaging with formal counseling services. These patterns are often grounded in cultural values, which, as Sue explained, shape how mental health is understood and addressed. At the same time, there are significant structural barriers that impact access to care. Durr identifies cost, lack of insurance, and limited availability of services as major obstacles to mental health care utilization. Language differences and a lack of culturally competent providers further limit access, as highlighted by Naji and colleagues. For some individuals, fear related to immigration status or interaction with formal systems can also discourage engagement with services. Vargas and colleagues emphasize that these systemic and legal concerns can directly impact willingness to seek care. Given these factors, culturally responsive care becomes essential. Research highlights the importance of building trust, validating lived experiences, and providing linguistically appropriate services. Sue and colleagues, and Dogan and colleagues have reinforced these points. It is also critical to recognize the role of migration related stress and adjustment challenges in shaping mental health outcomes, as discussed by Larius and her colleagues. Together, these dynamics influence how immigrants engage with mental health services. Immigrants are less likely to use formal care despite equal or greater need, may delay seeking help until concerns become more severe, and often rely more heavily on the informal support systems discussed. As Durr highlights, these patterns reflect not only individual beliefs, but also broader systemic barriers to care. Understanding these patterns provides an important foundation for considering how counselors can respond effectively. Building on those considerations, it becomes essential to adapt counseling approaches to effectively support immigrant clients. A foundational component of this work is the use of culturally responsive and culturally humble practices. Dogen emphasizes the importance of ongoing self reflection and awareness of power, privilege, and bias within the counseling relationship. This includes adapting communication styles and recognizing that individuals may have different cultural frameworks for understanding mental health, as discussed by Sue and colleagues. Providing language accessible services is also critical to ensuring equitable care. Counselors must also address the psychological impact of migration. Acculturative stress, as described by Larius and colleagues, is also a significant factor influencing mental health outcomes and should be directly incorporated into treatment plan and planning. In addition, supporting clients in navigating identity development across cultural contexts is an important part of the therapeutic process. It is also important to recognize that many immigrants may have experienced trauma across different stages of migration. Vargas and colleagues highlight that trauma can occur prior to migration, during the migration journey, and after arrival due to ongoing instability or uncertainty. This underscores the importance of trauma-informed care. Another key consideration is the integration of family and community systems when appropriate. Durr emphasizes that many immigrants rely on these networks as primary sources of support, and incorporating them into counseling can enhance engagement and outcomes. At the same time, counselors should actively work to reduce stigma surrounding mental health. Malcherud and colleagues highlight the role of stigma in discouraging help seeking, suggesting that psychoeducation and normalization can be effective strategies for increasing engagement. Finally, effective counseling extends beyond the individual level. Dogen emphasizes the importance of advocacy in addressing systemic barriers that impact immigrant clients, including issues related to access, policy, and equity. Taken together, these strategies highlight the importance of flexibility, cultural humility, and a broader systems level perspective when working with immigrant populations. Engaging in this work also requires critical self reflection on how my own cultural identity shapes my perceptions, assumptions, and interactions within the counseling relationship. I identify as a white, Jewish, American born woman, which places me in a position of cultural privilege within the United States. This identity affords me a level of safety, access, and belonging that is not equally experienced by many immigrant populations. Because of this, it is essential for me to remain aware of the potential for unexamined biases. For example, I may unintentionally assume that systems such as healthcare, education, or counseling are equally accessible or trustworthy for all individuals, when in reality, many immigrants experience significant barriers, fear, or distrust related to these systems. Research also suggests that these perceptions are not formed in isolation. Kunst and colleagues found that members of the majority groups often evaluate and categorize immigrants differently based on perceived characteristics such as warmth or competence. This highlights how broader societal narratives can shape individual biases, reinforcing the need for ongoing self-awareness. There is also a risk of minimizing or misunderstanding immigrant experiences if I rely solely on my own cultural framework. Experiences such as acculturative stress, fear related to legal status, or systemic discrimination may fall outside of my lived experience, yet they are central to the realities of many immigrant clients. Dogen emphasizes that developing a cultural competence is not a static achievement, but an ongoing process that requires movement from awareness to action and advocacy. This aligns with the concept of cultural humility, which involves continuous self reflection, openness to learning, and a willingness to acknowledge what I do not know. Similarly, Sue and colleagues highlight the importance of recognizing systems of privilege and oppression within the counseling practice. This includes understanding how power dynamics, systemic inequities, and cultural differences influence both the therapeutic relationship and client outcomes. Moving forward, my goal is to approach counseling with a stance of curiosity, respect, accountability. This means actively seeking to understand clients' cultural contexts, listening without assumptions, and adapting my approach to meet their needs rather than expecting them to conform to mine. Ultimately, self-reflection, it's not a one-time task, but an ongoing responsibility that is essential for providing ethical, effective, and culturally responsive care. For my cultural plunge, I attended a talk at the New York Public Library featuring writer and journalist Daisy Hernandez, whose work focuses on immigration, identity, and belonging. Before attending the event, I expected to hear a discussion centered primarily on immigrant hardship and resilience. While those themes were absolutely present, what stood out most was Hernandez's framing of citizenship as something far more complex and fluid than I had previously understood. She described citizenship as amorphous, meaning that it is not simply a fixed legal category, but something that is experienced differently depending on context, perception, and power. This idea challenged my prior assumption that citizenship is a clear binary status. You're either documented or undocumented, included or excluded. Instead, Hernandez emphasized that individuals can exist in spaces of partial belonging, where they may be physically present in a country, contributing to society, and deeply embedded in their communities, yet still experience exclusion, fear, or instability. This perspective connects strongly to the research. Vargas and colleagues highlight how immigration experiences are shaped not only by legal status, but also by broader social and political conditions that influence safety, access, and well being. Similarly, Kunst and colleagues demonstrate that belonging is socially constructed, with certain groups being more readily accepted than others based on dominant cultural perceptions. One of the most impactful aspects of the event was how it prompted me to reflect on my own assumptions. I realized that I had been approaching immigration through a somewhat simplified lens, one that unconsciously categorized individuals based on legal status or perceived legitimacy. Hernandez's discussion made it clear that these categories fail to capture the lived realities of many people whose experiences are shaped by ambiguity, resilience, and ongoing negotiation of identity. It also made me more aware of my own position of privilege. As someone who is American born, I have never had to question my right to remain in this country, nor have I experienced the kind of uncertainty that Hernandez described. This aligns with Sue and colleagues' emphasis on the importance of recognizing systems of privilege and how they shape our perspectives and interactions. Additionally, the event highlighted how narratives about immigrants are often oversimplified or distorted, which can contribute to stigma and misunderstanding. This connects to Maltrud and colleagues who found that stigma plays a significant role in shaping mental health outcomes and help-seeking behaviors. Overall, this experience shifted my perspective in a meaningful way. It reinforced the importance of moving beyond labels and categories and instead approaching individuals as complex, multifaceted human beings. As a future counselor, this experience will influence how I engage with clients by encouraging me to remain open, curious, and attentive to the ways in which identity, belonging, and citizenship are lived and experienced rather than assumed. In addition to understanding cultural experiences and counseling approaches, it is essential to identify concrete resources that can support immigrant clients in real world settings. In New York City, there are several organizations that provide accessible and culturally responsive services. One important resource is NYC Care, which offers low or no cost healthcare services regardless of immigration status. This is especially important for individuals who may not qualify for traditional insurance, but still require consistent access to care. Bellevue Hospital Center is another key resource, providing multilingual mental health services and experience working with diverse and immigrant populations. Access to language concordant care is critical for building trust and ensuring effective treatment. Organizations such as The Door offer integrated services, including mental health support, legal assistance, and social services, particularly for young people navigating these complex systems. For individuals who have experienced trauma, Safe Horizon provides trauma-informed counseling and support services, which can be especially relevant for those affected by violence or instability. Make the Road New York also plays an important role by offering community-based support, legal services, and connections to mental health resources, while addressing broader systemic challenges faced by immigrant communities. Another particularly impactful resource is Terra Firma, which provides integrated medical, mental health, and legal services for immigrant youth. This model is especially important because it addresses the interconnected nature of immigration-related challenges, including trauma, legal instability, and access to care within a coordinated and culturally responsive framework. Together, these resources highlight the importance of accessible, culturally responsive, and interdisciplinary approaches to care. As a future counselor, being aware of and able to refer clients to these services is an essential part of ethical and effective practice. As we've seen, these experiences are shaped by both significant strengths, such as resilience, cultural identity, and community support, as well as systemic challenges, including discrimination, acculturative stress, and barriers to care. Cultural perceptions of mental health and counseling play a critical role in shaping how individuals engage with services, often influencing whether support is sought at all. Because of this, it is essential for counselors to adopt culturally responsive and trauma-informed approaches that are very flexible, very respectful, and grounded in an understanding of each client's lived experience. This also requires ongoing self-reflection. Recognizing our own identities, biases, and areas of privilege is not a one-time task, but an ongoing responsibility that directly impacts the counseling relationship. Ultimately, effective counseling with immigrant populations requires more than knowledge. It requires humility and adaptability, and a willingness to advocate for clients within broader systems. By integrating these principles into practice, counselors can better support clients in navigating complex experiences of identity, belonging, and well-being. Here are the references used to put together this presentation. Thank you so much for listening.